Values, Ethics, and Advocacy, Part 2. Again, it's on page 126 at the bottom and extends into 127. So nurses have the right to practice in a manner that fulfills obligations to society and to those receiving nursing care. They have the right to practice in environments that allows them to act in accordance to their professional standards and legally authorized scope of practice. They have the right to work in an environment that supports and facilitates ethical practice in accordance to the Code of Ethics of Nursing. They have the right to freely and openly advocate for themselves and for their patients without fear of retribution. They also have the right to receive fair compensation for their work consistent with their knowledge, experience, and professional responsibilities. Practice in a work environment that is safe for themselves and their patients. They have the right to also negotiate the conditions of their employment either as an individual or collectively in all practice settings. Moral distress and resilience begins on page 127 and it extends into page 128. So moral distress occurs when you know the right thing to do, but either personal or institutional factors make it difficult to follow the correct course of action. Okay, so I know there was a lot of moral distress around the COVID with the mask shortage and having to reuse masks, which our standard of practice was always to dispose of those masks and just use them one time. However, we were instructed to use those masks all day, then put them under ultraviolet light, or put them in a brown paper bag, and then reutilize those masks again. Right? So that was causing some people moral distress, not being able to change those supplies, which is what we were all taught. Moral resilience is develop the capacity to respond well to moral distress experiences that emerge. So being able to deal with not having the proper masks that we needed in order to care for our patients properly and to protect ourselves. You had to have some resilience to be able to say, it's all right, I'm going to be able to get through this. I'm not going to become ill. I'm not going to die. I can still take care of these sick individuals and I can do this and do it competently, right? So that took moral resilience, which is developing the capacity to respond well to moral distress and then emerge strong. So resilience is a thing that we realize in healthcare. It truly exists as we survived COVID, right? Survived the pandemic. So ways to build resilience includes cultivating good relationships, accepting that change is part of living, refusing to view crisis as insurmountable, nurturing a positive view of self and taking care of self. So self-care is key. You cannot care for someone else if you do not care for yourself first. Nurses are famous for caring for everyone except themselves. Keeping things in perspective. So these are all ways that you can build resilience. So if in fact moral resilience was not a strength of yours during COVID, this is something that you can build, right? So on page 130, it talks about using a nursing process to make ethical decisions. Okay, so the nursing process is assess, diagnose, plan, implement, evaluate. All right, so assess the situation or gather the data. So recognize and then describe the situation and the contextual factors that gives it an ethical problem. Okay, so we're identifying in our assessment of this ethical issue what the problem really is. So diagnosis, identifying the ethical problem. So clarify the issue is of an ethical nature, and there is a conflict of personal or interpersonal or institutional, social, some type of conflict exists. Then for P, identify and weigh alternatives. So identify options and explore the probable short-term and long-term consequences for each stakeholder and use ethical reasoning to decide the course of action that you can justify ethically. I, implement your decision. Implement your decision begins to compare to the outcomes of your actions with what you considered and hoped for in advance. Evaluate your decision. What have you learned from the process that will help you in the future? So was it a good decision? Did your action plan work, right? So I think it is likely and very important to know, have a good understanding of ADPI and just know how you can apply this to an ethical situation. Because this could possibly be, since we learned about the nursing process and we also are learning about how to use the nursing process in an ethical situation, they could possibly give you an ethical scenario and ask you about ADPI or what stage of ADPI is being utilized. We have a true or false question. A nurse who is dedicated to providing culturally competent care to her patients finds herself without the resources to communicate with a patient who speaks a different language. This problem may result in a moral distress for the nurse. True or false? And I'll give you a minute. Answer is true. So if you chose A, you are correct. This problem may result in moral distress for the nurse. Moral distress occurs when the nurse knows the right thing to do, but either personal or institutional factors make it difficult to follow the correct course of action. And I also want to reference page 131 for the previous slide where we use ADPI for the nursing process for ethical decision making. There is a box 6-4 that also explains the ethical decision making using ADPI or the nursing process. On 132, we have ethical relevant considerations. All right, so they include balance between benefit and harm when caring for a patient, disclosure or informed consent. You want to make sure the patient has full knowledge of all the risks and benefits of any type of procedure or medication, just so they can make an informed decision, right? Norms of family life. So these are all ethically relevant considerations. Okay. So what is considered normal for their lifestyle or their culture? Relationships between clinician and patient. So you always want to develop a good, trusting, therapeutic relationship with your patient. Professional integrity of clinician. So you want to be professional. You want to always present yourself in a non-judgmental way and just be a neutral body, providing care equally to all. All right. Cost effectiveness and allocation. So you do not want to haphazardly utilize supplies or things that are going to be directly billed to the patient. You don't want to make sure that you are not carelessly getting things ordered that they do not absolutely need, that you're not 100% sure that they actually absolutely need. And the example of that is they're being discharged and you're ordering them a commode. However, they already have a commode at home, or they have a raised toilet seat. All right, so issues of cultural and or religious variations. Okay, so these are all relevant for ethical consideration. And consideration of power. So who makes the decisions? Who should be consulted also in reference to the patient's care, right? Who do they confide in reference to what they are deciding to do with their care? Some examples of ethical problems begin on page 132, extend into page 134. So paternalism is when the nurse acts like a parent in making decisions for the patient. Deception is when falsehood is told to the patient to possibly benefit the patient. So you may tell them, oh, this won't hurt, as you give them a needle to help decrease the anxiety. However, it is deception. Privacy and social media. So taking pictures and posting them on social media of the patients is a no-no. So we cannot do that in our clinical setting at all, whether work or even as a student. Confidentiality. So maintain confidentiality or confidential information, even if it's something that could possibly benefit the patient. If they ask you to maintain that confidentiality, please do, unless it's something that is a mandate that you have to report it. Allegation of scarce nursing resources. So unable to meet the needs of all your patients. That can present with an ethical issue if you don't have enough washcloths or towels or incontinent briefs, or just basic things like toothbrush, toothpaste, soap, water. I mean, not water, but soap or lotion, so a shortage of supplies could be a problem. Valid consent or refusal. So you have to respect your patient's decision. If they gave consent and then rescinded that consent or refused later, it is a refusal unless they change their mind and give that consent again. All right, so you have to respect your patient's decision. And if they're giving consent, usually there's a form to be signed. Oftentimes the provider will get that signed. However, you may be asked to do that. Conflicts concerning new technology. So your book gives a good example about um, in vitro fertilization and storing embryos. So that is what they speak of when they say new technology, nothing computerized or software related, but just newer medical interventions. And so you want to just be present and make sure that if they're experiencing any type of moral distress making that ethical decision, um, then it's their decision, and all you can do is be present and a listening ear, make sure that they are well informed so that they can make an informed decision. Okay, here are some more examples of ethical issues. So this is the bottom of 134 into 135. So ethical, unprofessional behaviors. So you want to report anything that appears to be peculiar, any type of peculiar behavior or change in behavior from your colleagues. Okay? If they appear to be unfocused, not concentrating, impaired, you are responsible to report that. Okay, I know that's an ethical dilemma because this is someone you work closely with and maybe you don't want to get them in trouble. However, if they do seem to be that they are not 100% or just different from their baseline, it's worth mentioning. Unprofessional, incompetent, unethical, and illegal nursing practice is mentioned again. And in this example, it's talking about reporting inappropriate behavior. Okay, so we want to report any type of inappropriate behavior, all right, regardless, even if it is your colleague or superior. Short staffing presents an issue as we struggle in this nursing shortage. So short staffing can increase risk factors for patients to develop possibly skin breakdown or some kind of complication related to self-care, right? If we don't have enough people to meet the basic needs, okay, care is compromised. So this poses an ethical issue and oftentimes moral distress for the workers. Beginning of life issues. So this may conflict with your personal beliefs, right? So you may be a single woman that's pregnant and now you want to get a abortion because you don't want to have a child out of wedlock. However, abortions conflict with your personal beliefs or religious beliefs, and this is posing an ethical problem, right? So you just want to be um, present and a good listening ear. This is their decision to make, okay? So their personal beliefs and their ethical obligation are in conflict and they have to make an informed decision. And the same with end of life issues. So end of life issues, you may have someone that is on hospice or palliative care, or they just may be dying from a terminal illness and they want to just slowly go into a gentle sleep and not wake up. However, assisted suicide is not legal anywhere in the United States except for, I believe, Washington State, I believe it may be legal. Don't quote me, but it's definitely not legal in Pennsylvania. So this is an ethical dilemma because you're watching this person suffer and they're asking to just be, put to sleep so that they can just go into a deep sleep and not wake up. So this poses as an ethical issue as well. Okay. I have a question. So a nurse attempts to obtain an order for a feeding tube for an anorexic teenager who refuses to eat. What is the term for the ethical problem this nurse is experiencing? So we have A, deception, B, confidentiality, C, allocation of scarce nursing resources, D, advocate in the market-driven environment, and E, paternalism. I'll give you a minute. You are correct. Paternalism, E. Paternalism occurs when a nurse asks for a patient without consent to secure good or prevent harm. Deception occurs when a nurse deceives a person for a perceived benefit. Patient confidentiality is questioned when a patient's confidence may lead to harm. Allocation of scarce nursing resources and advocacy and market-driven environment involves patient harm due to inadequate staffing and finances. 35 begins the Nurse and Ethics Committee. So it states 4 functions of the Ethics Committee. However, we have 6 bullets here. So the Ethics Committee responsible for education, policy making, review of any ethical dilemmas or ethical cases or concerns, consultation, so consultation to any type of specialist or even legal consultation if in fact this ethical decision needs to go to court. Quality, so you want to always maintain quality of care, and occasionally research. Okay, so these are functions of the Ethics Committee. Conflicts of commitment is on page 135. So the nurse primary commitment is to the patients, whether an individual, family, group, or community. The nurse owes the same duties to herself, him or herself, as they do to others. So their commitment also includes responsibility to preserve integrity, to maintain competence, and to continue personal and professional growth. The nurse cannot take care of anyone if they do not take care of themselves. So self-care is important. So that is another commitment. Advocacy for nursing practice begins on page 136. So it is the primary commitment to the patient, prioritization of good of individual patients rather than society in general. So that's our deontology. Evaluation of completing claims of the patient's autonomy and patient's well-being. So is your patient competent to make these decisions? And if so, then we are definitely advocating for the decisions they make, whether these decisions are the best or not. Okay? We're just doing what's right by the patient. Of concern begin on page 137 and extends into 138. So areas of concern for patients include representing patients. So nurses spend a lot of time representing patients, so just supporting their clinical decisions, right? So the care plan is a partnership between the healthcare provider and the patient, and so we are representing the patient and supporting their decision in their care. Promoting self-determination. So nurses are advocates. We are not decision makers for our patients, okay? So that paternalism, that is not a good thing, right? That's when the nurse is making decisions and being a parent-like figure for the patient. However, we do not make decisions for our patients. We allow them to make informed decisions, or their power attorney, or next of kin, or their spouse, to make informed decisions in reference to the care if in fact the patient is unable to make their own decisions. Okay? But we are only there to advocate and support. Whistleblowing. So it is a duty of the nurse to report any unsafe conditions. Period. That's it. Being politically active. So being a voice for communities and populations that are marginalized and underserved.